Hey everybody, gonna give a little talk about Lamictal and its uses. It's great medicine. My name's Mark Harvey. I'm a psychiatric mental health nurse practitioner, teaching other PMHNPs and students about psychiatry. Share my screen. Oh, hold on. Okay, Lamotrigine is a mood stabilizer, all right? It's actually seizure medicine. It's one of my faves, for real. If Lamotrigine is working, you feel normal and you don't even know that it's working. You don't really know that you're taking it because it doesn't have side effects. It doesn't make you fat or tired or stupid. Okay, so maybe it does do some of those things to some people, but for the most part, for most people, it doesn't sedate you, doesn't lower your IQ, and it does not make you gain weight. It's good from working from below. So if you have bipolar and you get depressed, it brings up the depression. So you're not getting depressed so much. Okay. Oh, I'm at work and somebody's trying to get me to do some work. Oh, no. Okay. So anyway, how do I forward my slides? Oh. Huh? No, no. There, okay. Hey, it's a folate antagonist. It was marketed first for treatment of partial seizures in the US in 1995, approved by FDA for treatment of bipolar in 2003. It is not for acute mania. It's best to stabilize the mood from below, bring it up, and not smash down a manic episode, okay? There's other medications that are much better at smashing a manic episode than Lamictal. Bioavailability, 98%, steady state plasma half-life of 25 hours, so that's great. Once a day dosing for most people. It's completely absorbed and food does not affect its absorption. Technical issues, it's a voltage sensitive sodium channel blocker. That sodium channel modulates glutamate and aspartate. So basically, it's a stabilizer of neuronal membranes. That's why it's an anti-seizure medication or anti-epileptic drug. Okay. Lamotrigine is a weak inhibitor of DHFR, kind of like methotrexate, which is a very powerful inhibitor of DHFR. Okay. What do we use it for? Bipolar disorder. It lengthens the time between episodes of depression and mania. It's more effective in lengthening the time between depressive episodes where you crash and get low than it is the manic highs, manic episodes. Works for rapid cycling bipolar also. Might help with borderline personality disorder, which in my opinion is often misdiagnosed as rapid cycling bipolar. But anyway, it's helpful in some pain syndromes, maybe. I don't know about that. I've never used it for that. Okay, why do I like it? Because of the tolerability of it. No metabolic effects like diabetes or dyslipidemia. People feel normal when they're taking their Lamictal, which is a problem because then they stop taking it and then they don't feel normal anymore. What are some side effects? Well, dizziness, fatigue, maybe blurred vision, headaches. Effects are usually quite mild. And, you know, it can be used to treat headaches or prevent migraines. Okay, so possible cognitive impairment, but not nearly as bad as Dopamax. Joint or back pain I've heard of. Anemia, trouble with coordination, rash, allergic reaction. So you can get an allergic reaction to Lamictal and have a rash, okay? That's important to know. And in fact, I want to tell you what my Steven Stahl prescriber's guide says about that. So in Lamotrigine, in the section on Lamotrigine, if the patient develops signs of a rash with benign characteristics, like it peaks within days, settles in 10 to 14 days, is spotty, non-confluent, non-tender, has no systemic features, and laboratory tests are normal, reduce Lamotrigine or stop increasing it. Warn patients to stop the drug and contact physician if rash worsens or new symptoms emerge. Prescribe antihistamines, topical corticosteroids for the itching, H2 blockers, just like you would treat allergic urticaria, okay? However, we got to talk about the bad rash, a rash that is confluent and widespread, purpuric or tender, with any prominent involvement of neck or upper trunk, any involvement of eyes, lips, mouth, any associated fever, malaise, pharyngitis, anorexia, or lymphadenopathy, abnormal CBC, liver function test, urea or creatinine. Stop the Lamictal immediately. Monitor and investigate organ involvement, which means probably need a trip to the emergency room for hepatic, renal, and hematologic workup. They may require hospitalization. Okay, so you can have a normal rash, allergic reaction, or you can have a bad Stevens-Johnson syndrome kind of rash, and this is a bad rash. So if you get a funky bad rash, you got to get it checked out. So then what I tell patients is, if your skin starts peeling off, blistering, it's painful, it's toxic epidermal necrolysis, fever, swollen lymph nodes, this is a bad kind of rash, okay? Now, when you titrate Lamictal slowly, when you're starting it, people don't get the rash, okay? Children are more prone to it. People who take very high starting doses, and those who take Depakine or Depakote, valproic acid or divalproex, along with it. If you get skin rash with hives, blistering, peeling, or sores in your mouth or around your eyes, then you need to seek medical attention. Okay, the dose is 200 milligrams daily, period. Don't mess around with that. 200 milligrams is what works. I see people taking higher doses, and I'm just like, come on, there's no research. Start at 25 milligrams daily for 2 weeks, and then go to 50 milligrams daily for 2 weeks, which I just have them take 2 tablets for the second dose of 50 milligrams. So you can order number 42 of the 25 milligram tabs for the first month, first 28 days. Then they take 100 milligrams daily for a week, then 200 milligrams thereafter. Okay? Let me move my face up here. Now, if you give it with valproate, you got to reduce the dose. If you give it with carbamazepine, phenobarbital, phenytoin, or primidone, you got to increase the dose. So pay attention to your Hippocrates and your medication list, all right? FDA indications. Oh, now my face is in the way. Bipolar is what we're concerned about, but also migraine, headache with aura, prophylaxis, 100 milligrams daily. So it's a little lower dose for migraine prophylaxis. But I've used it in double trouble, people that have migraines and bipolar. It's a good choice. So Hippocrates says to get a creatinine at baseline and eye exam if prolonged treatment. I don't know if anybody really does that. Monitor, of course, when you start a new psychotropic medication, you should monitor for worsening depression and suicidality, clinical worsening of bipolar, and unusual behavior change. To stop it, do it over 2 weeks slowly so they don't have a seizure. Pregnancy, make sure they're taking their folic acid first trimester. It's probably safe in pregnancy, according to Hippocrates. Okay, there is an anti-epileptic drug pregnancy registry you can call to get the person on that list. In summary, titrate it slow according to the book. Don't mess around with trying to go faster or doing it wrong, because when the person gets Stevens-Johnson syndrome and dies, it's going to be your fault. Okay, It's good for a depressed bipolar. The goal is 200 milligrams daily. Higher doses don't help. Monitoring plasma levels is retarded, so don't do it. Why would you? The 200 milligram dose is the dose. You're not going to titrate it. And the value of genetic testing has not been established, so don't do it. Because why smash your patient with a $400 bill for something stupid that has no clinical relevance? How do I really feel about it? Well, okay, that's the end of my lecture. I'm going to stop sharing my screen. Thank you for watching. Please comment, like, subscribe, and give me suggestions for what you want to hear me talk about, because I'm planning to do like 150 of these videos this year because they're fun. And every time I do one, I learn something, and it helps me like process these medications. And hopefully it's going to help you too to process them and prepare for your board examination or your class test. Okay, Mark signing out because I have a patient, client. I call them clients. But anyway, okay. Talk to you later. Bye.